Hello everybody and welcome to the Tuesday edition of Video Clips, and I'll start with just a couple of announcements. Cannot believe we've already got the fall scheduled together. It seems like fall should not be coming here so soon, but in any case, Diet and Lifestyle Intervention course, which is a phenomenal program for doctors, dietitians, nurses, lay people, anybody can take it. Covers all kinds of topics, the science of plant-based nutrition, autoimmune diseases, gastrointestinal diseases, vaccinations, musculoskeletal diseases. It's a 15-module course, live and interactive through teleconference. If you haven't taken this course, I promise you it will change your life. And we always have great accompanying certification packages that you might want to consider too. The course starts right after Labor Day. We are taking enrollments at this point in time. And of course, our nutrition educator program for nutritionists will be offering courses in the fall. And we're going to start our psychiatric drug withdrawal program in the fall, but I'm going to wait and talk about that at the end of what I have to say today. Also, I'm teaching a two-day boot camp, a two-session boot camp, I should say, on autism in September. I feel that autism and cancer have some things in common, and one is widely divergent, polarized groups of people at the extreme edges of reality, in my opinion, claiming to have the answer to all of this. And so I'm teaching a course right now on cancer and nutrition and treatment, and we're trying to come to the middle and really look at what evidence says and not be so quick to throw the baby out with the bathwater, either on the traditional or the alternative side. The same thing, I think, has to be done with autism. So if you're not familiar with my boot camps, these are Friday night from 7 to 9, Saturday afternoon from 2 to 5, so they're very intensive. And I think this one is in mid-September. We record it in case you can't participate live. Slides are provided. I'll put this on a video platform at some point in time, but if you would like to participate in the live version and the advantages, interaction, asking questions, etc., this is your chance to do it. All right, I want to talk about psychiatric drugs today a little bit. I've talked about this a lot, so those of you who watch this YouTube channel or read a lot of the things that I write know that I'm pretty prolific in this area. One of my business partners is Dr. Peter Breggin, the psychiatrist in New York, who I will come back and talk about a little bit at the end of this. But the bottom line is the drug companies and the psychiatry profession have convinced millions and millions and millions of people that psychological issues like depression and anxiety are caused by chemical imbalances in the brain. And the promotion of these, as it turns out, incorrect ideas have been so effective that by the year 2010, 254 million prescriptions were written for antidepressants. And at that time, 1 out of 10 Americans was taking an antidepressant, 1 out of 10 Americans over the age of 12. But there is no documentation supporting the idea that there is a chemical imbalance in the brain that leads to psychological disorders. According to psychiatrist David Healy, he says, and I'm going to quote this to you, "Indeed, no abnormality of serotonin in depression has ever been demonstrated." And psychiatrist David Kaiser says, quote, "Patients have been diagnosed with chemical imbalances despite the fact that no text exists to support such a claim, and there is no real conception of what a correct chemical imbalance would look like. Yet, conclusions such as depression is a chemical imbalance are created out of nothing more than semantics and wishful thinking of scientists and psychiatrists in a public that will believe anything now that has the stamp of approval of medical science." End of quote. I'd like to think that that's changing, that people will believe anything. I think that's one of the reasons why we're busy here, is people are looking for better alternatives. Now, Kaiser goes on to say that psychiatry, and this is a quote, has quite literally lost its mind, and along with it, the minds of the patients they are presumably supposed to care for. He says that biological psychiatry promises easy answers for a public that wants easy answers for complicated problems, saying to give a patient nothing but a diagnosis and a pill demonstrates arrogance, laziness, or bad faith, adding that psychiatrists need to be aware of the fact that they can easily be the agents of social control and coercion. And boy, is that true, because you actually can be committed to an institution against your will and subject to release only when a psychiatrist says that you're okay to release. And I know personally people who have had this happen, and their failure or refusal to take drugs often works against them in trying to get out of the institution, because successful treatment always involves drugs. Well, as long as the public believes that there's a biological cause for psychological issues, psychiatrists are going to prescribe the drugs and patients will take them. Studies show that when patients are told that their depression is due to a serotonin deficiency, they think that drugs are a better option than therapy, and they also become convinced that drugs will be effective for treatment. But because the drugs are prescribed for a non-existent condition, they can't possibly be effective. Therefore, it's not surprising that patients have worse instead of better outcomes. Research shows that patients taking drugs have, quote, more pessimism about their prognosis and lower perceived ability to regulate negative mood states. David Carlotte is a very interesting psychiatrist and instructor at Tufts University, who at one time was a paid consultant to Wyeth. He reports that in that role he was promoting Effexor to other doctors and ended up, quote, these are his words, tweaking and pruning the truth in order to stay positive about the product. He eventually resigned, and now he says, quote, what we don't know is how the medications actually work in the brain. What he goes on to say is almost difficult to believe. He says, I'll often say something like, the way Zoloft works is it increases the level of serotonin in your brain, and presumably the reason you're depressed or anxious is that you have some sort of deficiency. And I say that, and this was on a radio interview, so he sort of laughs out loud when he says this, not because I really believe it, because I know the evidence really isn't there for us to understand the mechanism. I think I say it because patients want to know something, and they want to know that we as physicians have some basic understanding of what we're doing when we're prescribing medicine. They certainly don't want to know that a psychiatrist essentially has no idea how these medications work, end of quote. Alan Fraser, professor of pharmacology and psychiatry, says that patients like the chemical imbalance theory because it makes them feel better about themselves. He says, quote, yeah, it's like I have depression, but I have a chemical imbalance, and you have hypothyroidism, and you have a chemical imbalance, and my chemical imbalance just happens to affect my brain, end of quote. Ronald Pies is a psychiatrist at Tufts University and former editor of Psychiatric Times. He says, quote, in truth, the chemical imbalance notion was always a kind of urban legend, never a theory seriously propounded by well-informed psychiatrists, end of quote. Well, I suppose from this we conclude that almost all psychiatrists are not well informed, since almost all of them have been for a very long time and continue to prescribe drugs to treat the mythical chemical imbalances. In another article, Pies attempts to clarify his statement by saying, quote, my impression is that most psychiatrists who use this expression, he's referring to chemical imbalance in the brain, feel uncomfortable and a little embarrassed when they do so. It's sort of a bumper sticker phrase that saves time and allows the physician to write out that prescription while feeling that the patient has been educated. But then by 2014 he changed his stance again, and he called the chemical imbalance theory a, quote, little white lie. Well, based on this, what we're supposed to believe is that psychiatrists give patients false information about their conditions because it makes the patients feel better about themselves and their doctors, at least for the moment. They refer to this deception as a little white lie, some of which of these lies are told so that patients will not realize that their psychiatrists are incompetent and they do not know how to help their patients get better. This type of deception would be considered criminal activity in almost any other industry, think like real estate, cars, appliances, so why does medicine get away with it? Well, regardless of the reasons, a significant percentage of Americans and people all over the world are taking drugs for depression and other psychological issues, about 25% in the United States. And these drugs are not just being prescribed by psychiatrists, they're now prescribed by family practice docs and gynecologists. It's easy for patients to start taking the drugs, not so much for them to get off of the drugs. And the reason is that the drugs cause changes in the brain, some of the changes that people are purported to have when they become depressed, which can make withdrawal a very painful experience, just like withdrawal from any other mood-altering drug like heroin or cocaine. This is why we have created a course, along with Peter Breggin, Dr. Peter Breggin, the psychiatrist in New York, called Why and How to Withdraw from Psychiatric Drugs, which is for medical doctors, nurses, psychologists, social workers, clergy, consumers, family members, and anyone who is taking the drugs or trying to help someone who is taking the drugs to withdraw. The course was developed, as I mentioned, with Dr. Breggin, a practicing psychiatrist who does not prescribe drugs and the author of several books that address this issue, how the drugs are not warranted and how they actually cause brain damage in people who take them. It includes specific information on how the drugs affect the brain, these actual causes of psychological distress, how to prepare for drug withdrawal, and the specifics of how exactly to withdraw from the drugs, including when they're taken in combination, which order you go off, how to dose down, on, etc. The course will be offered this fall, very proud of this. October 3rd is the start date, and it'll end in February. It starts in October and runs through February, and anybody who is concerned about this issue, wants to know more. By the way, I didn't mean to leave psychiatrists out of the invitation list here. We have some very forward-thinking psychiatrists, including one who's joined our faculty to help teach this course, who really understand this issue and want to do the right thing. So if you are one of those psychiatrists, please join us. Get this information so that you can become part of the solution instead of being part of the problem. All right, if you are interested in knowing more about this program, please send me an email at pampopper@msn.com, and I'll be happy to send you a course catalog. And by the way, these kinds of articles tend to be accompanied by lots of emails about where the references, this article with references, will be posted in the Health Briefs online library within a few minutes of the time that you see this video, so you can become a subscriber and access it there with references. Have a great day, and I will be back to you on Thursday with more news.